The couples who come to us for these procedures usually confuse between these two techniques. They think they are one and the same thing, but that's not the true. They are both very different techniques, and their process of fertilization in these both techniques is very different. In both of these techniques, IVF and ICSI, sperms and the eggs meet outside the body, that is in the lab, and the fertilization happens in the lab. That's why they are both the methods of artificial reproduction. But there are subtle differences between these two. In IVF, lot of sperms, like thousands of sperms, are being inseminated with the eggs in a petri dish. So the method of selection of the sperm is natural, and the naturally selected sperm goes and fertilizes the egg. So the fertilization happening during the IVF technique is similar to what happens during a naturally conceived pregnancy. Whereas in the ICSI, which is also called as intracytoplasmic sperm injection, a best looking sperm is being selected by an embryologist. It is being picked up with the needle and it is injected into the egg. While in ICSI, which is also called as intracytoplasmic sperm injection technique, a best looking sperm is being selected by the embryologist. It is picked up by the needle and then it is injected into an individual egg. In this technique, the sperm selection happens as an artificial method, and therefore it is slightly different from what is there in the natural pregnancy. But the chances of fertilization are more during this process as to what is there in the in vitro fertilization. And this technique is more suitable for the male partner who has a sperm count less than 5 million per ml. Whereas IVF is more suitable for the individuals who have the sperm count between 5 to 10 million per ml. ICSI is also better technique for the couples who have had failed fertilization with the IVF cycle. In couples in which male partner has bad sperm morphology, or in which they have dead or immotile sperms, in which they have no sperms, which is also called as azoospermia, or in the patients who have very low motility. Which technique is suitable for which kind of a couple requires an evaluation of both the male as well as the female partner, and accordingly the technique is chosen. If any other further queries are there between the differences in the technique and which is suitable for which, you can call or message us.